Hi, I'm Dr. Tom Bodenheimer. I'm a physician at San Francisco General Hospital. In this video, we will review two important topics involving interactions between healthcare teams and patients. The first topic is healthy behavior change. The second is about patients taking their medications. In both cases, the goal is to encourage patients to become informed and activated to self-manage their chronic illness. For years, health professionals have demanded that patients eat better and exercise by scaring patients or begging patients to make those changes. That rarely works. Healthy behavior change requires making an agreement between caregiver and patient, and we call that agreement an action plan.
Qué bueno que vino la cita. Hoy vamos a hablar un poquito del plan de acción que pusimos.
Medical assistants or community health workers are called health coaches. Coaches provide the skills that patients and families need to become active participants in their own care, performing a function that clinicians do not have time to perform. Adding a coach to a primary care practice or clinic takes some imagination. Sometimes a medical assistant can be given time to work as a coach. Sometimes a clinic can partner with a pre-med program, nursing school, health educator, or community health worker training program and train students to work as coaches. Even patients with proper training can make great health coaches. The two interactions you are about to see involve a health caregiver, who could be a doctor, nurse, health educator, or in this case, a community health worker, engaging a patient with diabetes in a discussion of healthy behavior change. Let's look at the first interaction between Victoria, the community health worker, and Senora Romero, who is a patient with diabetes.
Senora Romero, I'd like to show you this chart of your hemoglobin A1C.
Okay.
It looks like your hemoglobin A1C is about a 10. You should be about a 7. So you have to bring it down from 10 to a 7.
Okay.
So this means you're gonna have to increase your exercise, eat a little bit healthier, and you'll probably have to take an extra pill prescribed by your doctor.
Okay.
So put this graph on your refrigerator and that should keep you motivated.
Sure.
What just happened? Victoria has no idea if Senora Romero understands or agrees with what has been said. It is doubtful that Senora Romero will do any of the things that Victoria recommended. In this dialogue, Victoria tells Senora Romero what to do and never asks what she thinks. Let's try it again.
I would like to show you a graph of your hemoglobin A1C. Is that okay?
Okay.
Has anybody ever explained to you what this graph is about?
I've never seen it before.
Okay, do you know what a hemoglobin A1C is?
No.
Okay, so a hemoglobin A1C is a blood test, which gives us another way to measure how well your sugar is doing. This is a graph that measures your sugar over time. This red line right here is your hemoglobin A1C. This is where you should be. You want your sugars to be 7 or below. So 3 months ago, you were at goal at 7, but now you're at a 10, which is pretty high. Does that make sense?
Yeah, so you're saying that I need to be at a 7 where I used to be, but now I'm almost at a 10?
That's right. What do you think about that?
Well, I don't like it. I want my number to be back to a 7.
Is there anything that you feel that you can do to bring your hemoglobin A1C down to a 7?
I don't know.
It's okay. You have different options. Here's an action plan that we use for our patients here at this clinic. You can improve your food choices by eating healthier. You can increase your physical activity, or you can take your medications regularly. Is there something that you are willing to work on?
I'd like to work on improving my food choices.
Okay, maybe we can do an action plan around improving your food choices. Do you think there's something that you eat that causes your sugar to go up?
Well, I do eat 5 tortillas with every meal. Do you think that brings my blood sugar up?
Yes, it does. Do you think you can work on cutting down the amount of tortillas you eat?
Yeah, I'll cut them out totally.
Okay, that's good. But let's do a reality check. I just want to see how sure are you that you can stop eating your tortillas altogether. This is the scale we use to measure how sure you are. 1 means you're not so sure. 10 means you're very sure. Where do you think you lie in this scale?
I'm about a 2. I don't think I could give up my tortillas.
That's okay. We'll take it step by step. Is there anything you can do about your tortillas that you feel that you can succeed at?
I could eat 3 tortillas instead of 5. I'm 100% sure I could do that.
So that can be your action plan. When do you want to start?
Tomorrow. I need to get my A1C thingy down to 7 again.
Do you think that there's a place in your house that you can put this graph to motivate you, to inspire you to bring your hemoglobin A1C down?
I'll put it in my kitchen.
Okay, great. Is it okay if I call you in a couple days to see how you're doing with your action plan?
Yes, please. Thank you.
Good job, Victoria. How did you engage Senora Romero?
I kept asking Senora Romero instead of telling her. Every time I spoke, my sentences ended with a question mark. That allowed her to become an active participant.
Why is asking so important?
First, I don't like telling patients things they already know. Patients tend to resent that. So I ask, and if the patient doesn't know the answer, I explain the answer to them.
At one point, she said, my hemoglobin A1C is supposed to be 7, but now it's 10. What did you do at that point?
I asked her, what did she think about that? And she said, I don't like it. I want it to be 7. Now I knew that she was motivated to make a change.
And she actually did volunteer to stop eating her tortillas. But you didn't say, great, that's wonderful. You said, how sure are you that you can do that?
I didn't want her to fail, so I checked to see if she was able to succeed at her behavior change. So I found out that cutting down her tortilla consumption from 5 to tortillas per meal had a greater chance of success.
Then you arranged a follow-up phone call.
It's important to call the patient a couple of days after to see how they're doing with their action plan. Sometimes we have to change the action plan, and especially if the patient was prescribed a new medication, it's good to see if they're taking that new medication, and if not, why not? Patients appreciate our phone calls.
To quickly recap the coaching techniques to encourage healthy behavior change. Engage the patient by asking questions. Help the patient develop a realistic action plan. Follow up to monitor progress. Let's switch gears a bit and take a look at medications that can help to control diabetes, high blood pressure, and high cholesterol. Let's take a look. Sarah is a physician assistant who treats patients with chronic conditions.
Mr. Hayes, your diabetes is not in good control. We need to increase your metformin from 500 milligrams once in the morning and once in the evening to 2 pills in the morning and 2 in the evening. And I think that we may, if we can't get it under control, add glipizide. So I'm going to write you a prescription today for your increased amount of metformin, and then I'd like to see you back in a month.
Okay.
Sarah, how do you think that interaction with Mr. Hayes went?
Terrible. I never found out if he understood or agrees with the new medication plan. The community health worker wasn't involved in making the plan with the patient. And I worry that he may not take the medications as we are hoping that he will.
So let's give it another try. This time, Luis, a community health worker working with Sarah, is helping Mr. Hayes learn how to better self-manage his medications. First, Luis is engaging the patient in a pre-visit prior to the visit with Sarah.
Good morning, Mr. Hayes. How are you doing today?
I'm okay, Luis. How are you?
I'm doing fine, thank you. So, how do you think you're doing with your diabetes?
I think I'm doing okay, but, what's the chart say?
Your hemoglobin A1C is still high. It's 9.5.
Oh, that's no good. I know. It's supposed to be like 7 or lower.
What would you like to do to bring it down to 7?
Well, I walk every day like I'm supposed to. I work on the diet. I don't know what else to do.
Have you been taking the pill as Sarah prescribed?
Oh, this. Yeah, I don't remember the name. It's the bottle.
Oh, this is your metformin. This is the pill for your diabetes. Do you remember how should you be taking this pill?
Yeah, I'm supposed to take it twice a day, but I've been having kind of a problem.
It's like the problem like you couldn't pay for the copay or any side effects?
Yeah, it's the side effects. It's not the money, the side effects. I was taking it twice a day like they told me. And first I got these stomach cramps, and then I had really bad diarrhea. So, I had to stop taking it.
That makes sense. Let me see what Sarah could suggest, and we'll be right back.
Okay, thanks.
You're welcome.
About a third of patients take all prescribed medications, 1/3 take some of their medications, and 1/3 take none of their medications.
Hi.
Hi, Hi, Mr. Hayes. Good to see you again. How are you doing?
Pretty good, thanks.
Sarah, Mr. Hayes has told me that he's had a stomachache and diarrhea, and that's the reason why he has stopped taking his metformin.
Well, first of all, I'm glad you told us about your side effects because that really helps us make a better plan about your medication. And it's not uncommon to get a little stomachache and diarrhea when you're taking metformin twice a day. So how would you feel about taking the metformin just once a day in the beginning for the first week or so?
Yeah, I'll do anything that, if it's going to help with the diabetes, I'll try anything.
Okay. And then if you're tolerating it okay, then we could increase it to 1 tablet in the morning and 1 tablet in the evening. Does that make sense?
Sure, that sounds fine to me.
So Luis will prepare a medication list for you about when we would like you to take the medications. And then he can follow up with you by phone in the next week to see how you're doing. Any problems, let us know.
Okay,
Good. It's good
Thank
to
you.
see you again.
nice to see you.
Sarah and Luis are working together as a team. This is because clinicians, physicians, physician assistants, and nurse practitioners often have too many things to do in the 15-minute visit. The community health worker helps with crucial functions that would otherwise not happen.
Just to make sure Sarah was clear, starting tomorrow, how would you be taking your metformin?
I'm going to take it once a day in the morning.
What if you're feeling fine?
If I feel fine after a week, I'll start taking it twice a day. Once in the morning with breakfast, once in the evening with dinner.
Great. Can I call you in a week to see how things are going?
Please do. I'd be grateful.
Okay, I'm very happy to see you today, and I hope to see you in the next appointment. Have a great day.
Let me mention 2 key things that community health workers need to do after the visit. First, they check to make sure the patient understands what the clinician wants them to do, and second, they need to do follow-up phone calls.
Good morning, Mr. Hayes. This is Luis calling from your clinic. How are you doing today?
Oh, I'm good, Luis. How are you?
I'm doing fine, thank you. Could I ask you, how have you been taking your metformin?
I took it, for a week, once a day like we talked about, and I didn't have any problems. So yesterday I started taking it twice a day, and so far I'm okay.
Great. I'll let Sarah know, and she wants to see you in a month to see how your sugars are doing. Is that okay?
Oh, of course.
I'm going to transfer you now to our receptionist so you can make a new appointment.
The follow-up phone calls are essential every time a new medication is prescribed. Without these calls, it might take 3 months to learn that the patient never picked up the prescription from the pharmacy, forgot how to take the medication, or had side effects. Similar to the action plan discussion, both Luis and Sarah are constantly asking Mr. Hayes questions rather than telling him what to do. We know that 50% of patients don't understand or remember how a clinician wants them to take a medication. Asking the patient to repeat back the information on how to take a medication, like Luis did right after the visit with Sarah, is called closing the loop, checking to see if the patient understands. The other critical steps take place in the follow-up phone call, making sure the patient was able to get the prescription from the pharmacy, can afford the medication, understands the prescription, agrees with the prescription, and is actually taking the medication. To recap the key points about coaching for effective medication adherence, keep asking the patient. Find out whether the patient understands the medications and agrees with them. Ask the patient about barriers to medication adherence. Call the patient a few days after a medication change to see how things are going. I hope that viewers of this video will be able to implement some of these innovations.